Hi, I'm Dr. Martha Ann Keels. I'm a pediatric dentist in Durham, North Carolina, and I'm affiliated with Duke Medical Center, and I've been in practice for over 30 years. And a third of what we do in our clinic, and I have two other partners that pediatric dentists have 3 more years of training in addition to being a general dentist, and that training really helps us provide better care for children with special health care needs. So we do rotations in pediatric medicine, we do pediatric anesthesia, child psychology, and so a third of our practice, we're taking care of children with special health care needs, and we try to get them all the way through to college age or young adulthood before we transition to an adult provider. And so, probably my number one message to those of you attending this conference for AGS is to make sure that the children have a dental home by age 1, just because any child can fall and have an accident and tumble, especially the toddlers. And with AGS, it's possible, that you could have some effects that would affect the gait, that the child may fall and more easily tumble and have a dental injury. So you want to be able to have a name, have a number, and know, like in my case, my patients know our system of how to page us after hours, and that one of us is always on call, and so that you can get help, but also to learn some of the basics of taking care of your child's teeth, because you really want to protect the smile. And so for my special healthcare needs, I have one thing to show you, and you can order it from Amazon. It's called the Surround toothbrush, and it's got, anytime as an adult you have to brush someone else's teeth, it's really nice to have a toothbrush that's brushes the tooth on all the sides. So when you go in, you're getting the front, the back, and the top all at once. And then it makes it easier for you. And then I always recommend that. And in some cases, for parents, you're actually the care provider for your child's entire life. And then some children can learn how, like, we can actually add more grip to this so it's easier for any child to hold. But to really count, even for children without any special care needs, the guidelines are that a parent should be brushing and flossing their children's teeth through the age of 6, and count what you do as what it is, and then flossing through the age of 8, because flossing is harder. So the minute you have, and this is Daisy, our dinosaur, any two teeth that are touching, you should floss. So Daisy needs all of her teeth flossed, all of them. But in some young children's case, it might just be the molars in the back. But if you have gaps, you don't need to floss. But if you've got space, they're touching, you need to floss, because any kind of food stuff can get caught between the teeth. And so that's really important. And then also in that establishing a dental home, we go over like dietary recommendations. And in our practice, we actually have the first ever longitudinal study, meaning starting from birth, we have 1,300 children that we've followed since birth, and now these children are 9 years of age. That we're looking at things that what caused cavities, what causes the holes in teeth. And so we've learned dietary, like, that you really want to stay away from dried fruit, Skittles, Starburst, gummies, the gummy vitamins, anything really sticky. In the beginning of my career 30 years ago, it used to be raisins, and now we have colorful raisins, the fruit snacks, the fruit roll-ups, and the gummies, that those all get stuck in your teeth, and children don't go dig that out of their teeth. It stays there. In fact, children don't really become bodily aware till much older, and closer to adolescence. So you really want to be mindful that if you're giving something like that, that you need to brush and floss right after to get it out of the teeth, because the child might not be able to. And then some children with special health care needs cannot groom their teeth with their tongue. So how do you know if your teeth are dirty or not? Is with your tongue. You're going around, like, after you eat, you're grooming that food off your teeth. And also, like, after you brush your teeth, you might take your tongue around your mouth and go, wow, oh, that's still dirty. I need to brush that area more. So some children aren't able to get their tongues around their mouth. So you want to make sure, if your child is not able to do that, that just remember you're your child's tongue too, and you need to brush more frequently. So that would be after every meal. And just be mindful to try to not have those sticky snacks. The other thing to talk about in the first visit is habits, like pacifier and digit habits, like sucking your thumb. And so I tell every parent, you've got to make your own best decision for your child. So some children really need those soothing, the pacifier for soothing. But if you can, um, your child is, you could get rid of it by age 1. Those are the guidelines from the American Academy of Pediatrics and Pediatric Dentistry, is to try to wean them from that, because then you can start to get dental changes that can be difficult to correct. Because the longer you go with thumb sucking or pacifier, you're starting to change the shape of the upper teeth and making the front teeth protrude. And if your front teeth stick out further, then you have the risk of falling and breaking them or knocking them back. And with AGS, some of the children could have an increased risk of falling and bumping their teeth. So you definitely want to be careful about falling with something in your mouth like a pacifier. And so we try to make the guideline, especially trying in the day of COVID, like if you can keep your digits, your thumbs and fingers out of your mouth, that's another portal of entry for bacteria and viruses into our eyes and our mouth, is to, if we can, keep our hands off our face. And I know that can be challenging with a child with special health care needs, but we all just, as my mom always said, 80% of the time try to do it right, and 20% of the time it's just not possible. And I get that. I totally get that. The other thing I would be reviewing with a new patient is what do you do when the child falls and bumps a tooth? So a lot of times they just bump it a little bit and it's just some bleeding around the gum. You clean it up with a wet washcloth, soothe your child to stop crying, because when you're crying, your blood pressure's up and you're going to bleed more. And so you want to settle them and then clean the blood up and assess, is the tooth in the right position? And if it looks like it's been knocked back, and that's the typical direction, it gets pushed back toward the tonsils, you want to get your finger around it and snap it back into place. And it's an easy, gentle move back into place while right then and there. That is the best time to put the puzzle piece back together. If a lot of times, the longer you wait to call the dentist, get the dentist in their office, you get to the dentist's office, the tooth is tightening up in the wrong position. And then sometimes it's going to take a much stronger force on my part to get it back aligned. And I may have to numb it to be able to do that. Without numbing means a needle shot. Love to avoid that if I can. So I'm coaching parents over the phone through telehealth or through FaceTime to put your thumb behind it and just push it back and align it, and then call me. And then through telehealth, I'll have you send me a photo. We look at it, make sure it's aligned. If a baby tooth, for instance, is completely knocked out, we don't replant those because the success rate is very poor for the blood supply to reconnect to that tooth. Very different story than if you knock out an adult tooth. If it's, it's the child's permanent tooth, then if it gets knocked out, quickly put it right back in the socket. Just stick it right back in. You'll know which way is up. And it may not be perfectly positioned, and then bite on a washcloth or hold it there with a washcloth. Call the dentist and get in so the dentist can position that tooth more perfectly, and then sometimes has to put on a splint to hold it in place so it reattaches. And we have great success with that treatment, but don't put it in milk and then get to the dentist, because the milk will only keep the root alive 20 minutes. So in our career, we all wished that the milk story had never gotten out there, because a lot of parents would say, I got to go get the milks. And then they're driving to the grocery store to get whole milk and then putting the tooth in the milk. And we've lost critical minutes. So it's way more important to put it right back in the socket. And that would be true for even siblings that don't have AGS. It's the same. That's true. So other, and then we would talk about the diet, really trying to stick to milk and water, limit your exposure to sugar sweetened beverages. The American Heart Association's come out with guidelines, really starting to say 0 to 2, no sugar for heart health. And we go, yay, as dentists, we want no sugar too. And then from 2 to 18, no more than 6 teaspoons of sugar per day. And you're going to get that in your natural fruits and other foods. So trying to avoid adding any added sugars to the diet is real important for not only heart health, but for tooth health as well. So with AGS in particular, you can have some immune system effects, like, for instance, thrombocytopenia. So you might have more increased with thrombocytopenia. You might have Friday afternoon. I can't talk straight. You might have more bleeding gums, and so just be mindful that if they're tracking the platelets, that in some children, if the platelets get really low, then you need a platelet transfusion. So if the gums are bleeding a lot, then you might want to make sure to get the platelets checked, and then you get your platelets up, and then the gums stop bleeding. But if you're not haven't been brushing, you're going to have some gingivitis, and the gums are going to bleed till you start brushing regularly, which we recommend morning and bedtime. Flossing only once a day, but morning and bedtime brushing. And like I said, if you're having the child's unable to get their tongue around their mouth, then you need to brush after the lunch meal as well. And so we also worry about with AGS other immune system effects. In other words, the children can be predisposed to gum disease and periodontal disease. So what that means is the immune system isn't working to full capacity. And what happens in your gum gutter is, the gum gutter is around every tooth, and that's where the bacteria live. And your immune system keeps the white blood cells in that gum gutter fluid, keeps the bacteria from entering your body. So if those white blood cells aren't working up to capacity, then the bacteria can get down into the gums, and then the first sign will be bleeding gums, and then it'll get further down below the gums into the bone, and then you'll start to get loose teeth. So if you're starting to get loose teeth and there hasn't been a dental trauma where the child's fallen, then that child really needs to get into the dentist to be assessed. And in that case, what I would be doing is culturing. No different than a throat culture, except my culturing, the throat culture, looks like a big Q-tip. Mine's miniature, tiny, tiny Q-tip to get down into the gum gutter to get a sample of the fluid, so I can find out what bacteria has entered into the gum tissue and down to the bone. And then we identify what's the best antibiotic to give to kill those bacteria, because the immune system isn't working like it should. So then we augment with antibiotics and get rid of those bacteria. And then we work hard. In those children, I would probably be seeing every 3 to 4 months in the practice, not every 6 months, so we can really monitor and make sure the gums are staying pink, the teeth are tightening up and not being loose at all. So we would love that. And then monitoring. And sometimes we have to go through several culturing times because once you've used one antibiotic and you reculture, then you might identify more bacteria that we're hiding, and you have to switch and use a different antibiotic. And so until we get you to completely negligible bacteria that are down there, because that's what you want, is no bacteria growing down in your gum gutter, in your sulcus. So that's how I'd be managing that. So the other risks that with AGS, and I went and reviewed the literature, is more frequent ulcers in the mouth. And ulcers just take 7 to 10 days to heal. And really, for comfort, one of the number one things that children like is milk products. Just like you can get the milk mustache from drinking milk, is to do ice cream or milk products or milkshakes. Milk will coat that raw surface that looks like it would hurt. You can also purchase the teething gels like Orobase or Orogel. And I caution you just to use a little bit, like maybe just a tad, like my baby fingernail, not my whole fingernail, but just the white part of my baby fingernail, like that's like a grain of rice, smidgen on the ulcer to numb it so the child could eat. You don't ever want to use too much, because those gels contain benzocaine. If you were to use too much, meaning like the whole tube in one day, that would be a mistake. You could induce seizures. So you just want to be real conservative with it and just coat the ulcer. And you would maybe do that once or twice a day for comfort. But I find most kids don't want you touching it, so they don't want you putting anything on it. They would the milk products would be the way to go. And then another way to go is to give Motrin or Tylenol. So if you have thrombocytopenia, the pediatrician is going to recommend what you should use so that you don't affect the platelet function or reduce it for that. I would like to comment on if your child were to develop cavities, then we as pediatric dentists would be looking at the best way to manage that. And typically for our special health care, children with special health care needs, at least at Duke, we're going into the operating room, and we're in Duke Children's operating room 3 days a week because it's kind to the child that we can put them to sleep in the hospital. Our preference at Duke is to have a medical doctor managing the sedation and the general anesthetic, and we as dentists are just doing the dental work. I would say it's very stressful, and I certainly have in my training, we had to do both, and it's very stressful as a dentist to be working in a hole in the mouth and trying to focus my attention on doing beautiful dentistry and then keep turning my head to look at monitors and monitor the sedation and the anesthetic. So it's much better and safer for the child to be in the hospital where one doctor's got their job and the dentist has their job. And we're mainly restoring with white fillings now and white crowns. They now make crowns that are white, so the child's teeth, when they wake up, look natural, and that's what we want. We want, like we as dentists want, when your child smiles, we don't want anyone looking, oh, you must have had dental work. We don't want that. We want you to say, oh, you can't tell that was ever done. If when you see a pediatric dentist, half of our examination is also charting orthodontic needs. And so really focusing from age 4 to 14. And we start really earlier because some children in today's time, just due to the growth hormone and foods, they're having accelerated puberty. So in my career, for instance, puberty is happening 2 years younger. Like it used to start at age 10 for girls in the United States. Now it's down to age 8. So some children can start losing their teeth between 4 and 5, but they should start losing their teeth really between 5 and 6 and then be done with it by age 12. But we stretch that window out because there are varying things. Like if your child has delayed growth and development or delayed growth hormone, then they may not start losing teeth till age 7 to 8, and then they won't be losing their last tooth to 14. But during that time period of losing baby teeth, and you lose the front 8 as a cluster by age 8 typically, and then the body rests for 2 years, and then you get another growth spurt, and then you'll lose the last 12 baby teeth. So it's not uncommon for parents to call me and go, oh, I'm losing so many teeth. What's wrong with my child? And I'm like, no, that's normal. There are 20 baby teeth. You lose 8 by age 8, and then the last 12 altogether is a cluster, typically between 10 and 12. And then the pediatric dentist is going to be monitoring to see how we can best get all the teeth in and have them nicely aligned and maybe avoid braces. That would be great. So in some of our children with special health care needs, we're actually doing some extractions along the way to help get those teeth in as straight as possible. So maybe we can avoid orthodontics. That would be great. And certainly some children with special health care have beautifully lined teeth on their own genetically, but just they could have been born like me where I had a crooked mess. And I had big teeth from my dad and small jaws from my mom. It wasn't a good fit. So I've had a lot of orthodontics to get straight teeth. So we can also get straight teeth by guiding the permanent teeth in to help them get aligned. And it's really nice for all children, despite what their medical history is, that we get their teeth as straight as possible because it's easier to clean if they're having to be cleaned by a caregiver, but also easier for the child to clean their teeth. Because you're just going straight around versus if you have crooked teeth, you've got to slow down and go in and out. And crooked teeth retain a lot more food and catch a lot more food, and you have a higher risk of cavities. So I kind of wanted to give you an overview of the role of the pediatric dentist in helping your child stay cavity free as well as have straight teeth, the orthodontic part of it, and to also kind of address some of the special needs like the potential for falling and what to do for trauma and then the potential for the gingivitis and periodontal disease and bleeding gums from the thrombocytopenia and the immune system effects, and then also for the ulcers, what you could do. But certainly, I'm more than happy to be a resource to you. I can be reached by email, Keels, Keels 001 at duke.edu. I do get 200 to 400 emails a day, so if I don't respond right away, please understand that I treat patients 8 to 5, 4.5, and then Fridays 8 to 1. That I do have 7 grandkids and a husband, so I do have a life outside dentistry. So if I don't respond to you right away, know that I will eventually get to you. But thank you so much for this opportunity to talk with you. And I also think I'm joining a question and answer session later in the symposium. So thank you so much for having me, and I hoped I helped. Take care.